Good morning, everyone. We'll get started with this session. I'm so excited to be here today. I'm Samantha Wells. I'm a senior scientist at the Center for Addiction and Mental Health in the Institute for Mental Health Policy Research. My research involves community-based, community-driven, and participatory methods, so this session is of huge interest to me. I'm really excited about this talk and this series of presentations. And as you know, you're in this room, so you know that this is about community-based and participatory approaches in addressing the mental health impacts of the climate crisis. And I have some amazing presenters today. And I'll go through their bios very briefly, but feel free to look at the program for longer bios. First, the first panelist is Swelen Andari. Swelen is the Director, Strategy, Climate Resilience, and Youth Mental Health at CAMH. They're implementing a demonstration initiative aimed at advancing research on climate distress, climate action, and hope for youth. Trained as a creative arts therapist, Swelen has a decade of experience leading the implementation of system-level initiatives aimed at improving access, service design, prevention, and building leadership for youth with lived experience in the child and youth mental health system in Ontario. Swelen's career has focused on moving research into viable action by facilitating processes grounded in implementation science, systems thinking, innovation, decolonial practices, and equitable community engagement. So really excited to have you, Swelen. So we also have two panelists from York University. So Sarah Merghani is a third-year Bachelor of Science student, specialized honors student in global health, specializing in health promotion and disease prevention. She contributes to research at the Wellness Impact Lab as lab coordinator, where she supports projects on climate change and mental health, and at the Global and Environmental Health Lab as research assistant, focusing on climate and health equity. She is the co-founder of the NEST initiative, which we'll be hearing about today, which is a student-led climate wellness project supported through York's Agents of Change program. And we also have Sophia Bryan-Carbonell, who is a fourth-year specialized honors psychology student at York, specializing in neuropsychology and applied methods and analysis. She is actively involved in multiple research labs where she contributes to projects in neuropsychology, addiction, and mental health. In addition to her academic research, Sophia serves as lab coordinator at the Wellness Impact Lab and co-leads the NEST initiative, which you'll be hearing more about today. And finally, we have Dr. Siqi Xue, an academic psychiatrist at CAMH. She completed her medical and psychiatry residency training at the University of Toronto and Master of Science degree in global mental health at the London School of Hygiene and Tropical Medicine and King's College London, as well as Royal College of Physicians and Surgeons of Canada. She has a special interest in transcultural psychiatry, global health equity, and psychosocial responses and interventions in the context of climate change. These are really impressive bios, an incredible panel. So we will get started with the presentation. But first, I just wanted you to know that questions will be held at the end. So the three panelists will start, and then we'll have Q&A after the panelists speak. So I'll invite Swelen to kick us off.
Hi, everyone. It's really nice to be here. Thank you so much for having me. For today's presentation, I will actually start first by offering a very brief background on the challenges underpinning our work, which will actually hopefully also be informative for my fellow panelists. And from there, I'll speak to you about our initiative and Youth Taking Action on Climate Change and Active Hope. We are very much at an early stage of our work, and so it's really exciting to bring you into what we're doing at this stage. So young people are experiencing the disproportionate impacts of the climate crisis. A global survey of 10,000 youth across 10 countries found that 45 of these young people are feeling that climate change is negatively affecting their daily functioning and their daily lives. And many of them reported having negative thoughts. Consistently, we have also seen similar results locally. A survey done across Ontario showed that just a little bit over than 10,000 youth from grades 7 to 12 let us know that half of them almost are depressed about the future because of climate change. And so what we know, we're still learning a lot about this climate-related distress. What we know for now is that it actually exists in a spectrum. So for some people, strong emotions may actually become really overwhelming. They can lead to paralysis or denial in face of the large issue that we're facing. And it can even impact their daily lives and their mental health. And for others, it can actually encourage them to engage in pro-environmental actions. It can empower them and be a source of motivation. And basically, our mental health systems in Ontario and in Canada are simply not prepared to face the accelerating impacts of this challenge. There is not enough recognition of the gravity of the issue. Where we see this reflected as the lack of intentional structures and networks and actual resources invested to support climate-related distress. But also, there's a limited amount of interventions that are out there to actually address these impacts. And from the ones that are available, really, these ones are not robustly evaluated. And moreover, these interventions are simply not embedded in public services and in our public health system. And so, largely, there are no public supports that are available to support young people facing the impacts of climate change. So these are the gaps that we are trying to address with our work. Not only do we want to develop a new intervention, but we want to be investing in building the capacity of our system so they can adopt these interventions and propagate them. And so we're starting to do this work by actually looking at what we do know and what we do have, which is a growing set of evidence of promising approaches that promote psychosocial well-being that we can integrate as actual core components in the development of interventions. And approaches like social connection, promoting a sense of community belonging, enhancing cross-sector collaboration, promoting emotional resilience, psychological adaptation, and also promoting collective action. And we know that we want to do all of this by grounding it in culturally appropriate and culturally relevant interventions. We hope that integrating all these components can also have co-benefits, not only for the health of people, but for the health of the planet. And what we also know is that young people have an immense capacity to actually shape systems change in very unexpected and very impactful ways. We have seen it, for example, on how young people supported the ideation of a youth wellness hubs model for integrated and accessible and responsive care. In 2016, the Youth Can Impact Study, which was informed by the voices of young people, launched this model with 3 hubs. And right now, we have seen it expand with 32 Youth Wellness Hubs Ontario networks that are permanently funded by government, which is really incredible. So these are the actual elements that are inspiring our first participatory research and systems change initiative, Youth Taking Action on Climate Change and Active Hope. We are collaborating with youth, but also experts from across sectors and disciplines to adapt an active hope program that with and for youth. And we want to actually create a pathway to rigorously evaluate it and understand how, what kind of conditions we actually need to support its viability and scalability across the youth mental health and also social service sectors. And not only do we want to do this locally, but we hopefully want to scale this up nationally. We're at the early stages of this work, and so I'll share a little bit more about our process. Under the leadership of Dr. Joe Henderson, we received a grant from CIHR to conduct the first phase of our initiative, and here are our partners. I spoke a little bit about our goals, but I want to emphasize that one of the main pieces inspiring this work is really addressing the relational crisis that is underpinning climate change. And so one of our main goals is actually to center and amplify youth leadership in creating pathways to restore and revitalize our connections to land, to community, to self, as a way of promoting youth psychosocial well-being, but also their collective agency. We also hope to enhance the capacity of our system, our mental health system in particular, by growing collaborations and emergent research at this intersection, but also so we can enable the conditions that will support the adoption of these solutions within publicly funded youth mental health and social services to actually make it available to those who are most in need. So what is Active Hope? Active Hope was developed by Joanna Macy and Chris Johnstone. It's an evidence-informed framework that offers a compassionate pathway for people who are living with hopelessness and despair about the crises that we're facing, and supporting them to engage in inspired collective action for climate-resilient futures. It draws from wisdom from contemplative traditions, from Western sciences, also from the Haudenosaunee Confederacy, as well as wisdom from leaders, artists, activists, and justice-driven communities that are working towards climate justice. Rather than viewing climate distress as an individual problem, Active Hope reframes these emotions as meaningful responses to systemic injustice. And it's meant to empower people to see hope not as something that one has, but rather as something that one does as a practice. So Active Hope is a capacity to envision a future that is more just, sustainable, and caring, but also be an active participant in the present, in the here and now, to make that future a reality. There is limited research on this model, and so there's a need to build a more robust evidence base, but also the model has not been adapted for youth populations, and so these are the gaps we're filling. To tell you a little bit more, the Active Hope framework has 4 phases. It's meant to walk people through a group-based type of program where they engage in, first, in accessing practices of gratitude and what does it mean to really harness connecting ourselves with the wider web of life and our relations as a way of resourcing oneself in moments of hardship. And then it supports young participants to be present with their experiences of grief, pain, or any kind of psychological distress related to the climate crisis and the other crises happening simultaneously. It's also meant to move people to see with new and ancient eyes, meaning it cultivates an ecological awareness and a sense of interdependence, as well as solidarity across species, but also across generations. So really, this phase is about expanding our vision about what is really possible when it comes to systems change by seeing ourselves as part of that cosmology that we heard earlier from our keynote speaker. And finally, the spiral actually ends by supporting people to create an action plan and build alignment between their values and their interests and really the change that they want to see in the world, while also preventing that we do some literacy, preventing burnout when engaging in collective action. We are guided by a set of principles that have really informed all the decisions that we've made in our design and our implementation, including two-eyed seeing, implementation science, human-centered design, systems thinking, climate justice, health equity. But really, the reason why these frameworks are important to us is because what we're really intending to do is to not replicate the same structures of harm that have led to the climate crisis in the first place. And also, we want to create the conditions that can facilitate scaling and adoption of these of this research into practice. We also follow the McCain model of youth engagement, which creates basically multiple opportunities for young people to be involved in our project, from building partnerships and decision making to being consultants in our study design and so forth. So all of these frameworks inform our 5-phase systems implementation plan. So really, this is a long journey for us. We really want to ensure that we're using and harnessing these structures that already exist. What are the organizations, the roles, the people that we can basically work with so we can embed these interventions and scale them and make them accessible for people. We are in phase 1, and we are very excited for the upcoming phases, which involve promoting youth-led policy advocacy, knowledge mobilization, but also beginning to do readiness assessments in our system, including Youth Wellness Hubs Ontario networks and other organizations that might be interested in being our first cohort implementers of this work. And that will allow us to test the feasibility of this model, understand how it works, and basically scale it across the country. And right now, we are specifically recruiting participants for our Photo Voice project, which we're really excited. Photo Voice is a qualitative participatory-based research model. It harnesses the power of visual narratives to promote critical dialogue and community connection and agency for young people. We are hoping that through visual stories, young people will be able to share their climate realities and what does it really mean to move through an active hope program, so we can have a viable program for young people. We've engaged youth in multiple ways. Here are some of the roles that you see. And youth engagement has been very important. Our engagement specialists, our advisors have shaped the tone and the direction of our study. They've made decisions with us. They have also supported us to co-design a new adaptation of this model. And we're hoping that the youth participants of the Photo Voice study will actually decide at the end of their journey what is the policy change that they wish to do and mobilize through their visual narratives. And we're going to support them in that journey. Our early learnings really speak to the power of these participatory methods in how not only they are pathways of learning, but in themselves, they're also the means through which we can achieve the outcomes that we're seeking and how we can actually promote psychosocial resilience. These participatory methods, including Photo Voice, really build agency and cohesion and really speak to the kinds of psychosocial factors that we're trying to promote. But also one of the important things that we've been learning from our youth collaborators and experts is that the adaptations that we do to this intervention really need to be centering psychological safety and literacy for young people. So we're learning that if we're going to be creating safer spaces for youth to actually process their climate-related emotions, we also need to be educating them. They're asking us to be educated on how we can cope better, how can we regulate our emotions, what does it mean to be trauma-informed, and can you give me also other ways of expressing myself that use the arts or that maybe don't require me talking. And so these are just initial things that we're learning, and we're very excited to see this grow. Thank you so much.
Great, thank you. And I guess Sophia and Sarah, come on up.
Hello, everyone. Thank you so much for welcoming us today. We're so honored to be a part of this panel, and we're really looking forward to spending some time with you. My name is Sophia Bryan-Carbonell, and this is my colleague, Sarah Merghani. And we're both undergraduate researchers at York University, where we work with the Wellness Impact Lab as lab coordinators. Together, we've been leading innovative approaches to climate mental health within the York community. And as students, it's a really rare opportunity to present at a conference like this, so we just want to say that we're so grateful to share our experiences, not only as researchers, but also as peers living in this climate crisis. So before we begin, we'd like to invite you for a moment of reflection. On the screen, you'll see a series of images connected to the current state of the climate. We see wildfires, pollution, waste, even a cute little penguin. Take a few seconds to really look at them and notice what emotions come up for you as you stare at these images. Is it fear, grief, anger, maybe hope, or maybe all at once? And where in your body do you feel that emotion? These are the same kinds of images that we bring into our climate cafes at York University, where we ask students to pause, reflect, and share what resonates with them. It's a simple but powerful way to express emotions that often remain unspoken. But of course, these cafes didn't come out of nowhere. So to understand how we got here and why we created these spaces for students, let's take a step back and look at the work that has been happening in the Wellness Impact Lab where this all began.
Thank you, Sophia, for the introduction. So before we get started, we just want to take you back to where it all started, with this simple question that our lab kept asking. What does it really mean to support wellness in a world facing climate crisis? At the Wellness Impact Lab, that question has guided everything that we do. The lab was co-founded by Dr. Harvey Skinner and Susan Harris, who are here in the front today, two leaders who share a deep commitment to reimagining what wellness looks like in a time of global uncertainty. They believe that caring for our minds and our bodies couldn't be separated from caring for our planet. And from that belief grew a space that blends research, community engagement, and real action. The Wellness Impact Lab became a place not just to study change, but to create it, and to help people turn towards the climate distress instead of away from it. And from that strength, connection, and meaning in that process came the climate cafes. They are welcoming spaces at York University where students process climate emotions, share stories, and build community inspired by the Death Cafe model. And they focus on reflection and connection over activism, turning climate distress into resilience. So over the past year, our lab hosted 11 climate cafes, 7 in person and 4 online. And through open dialogue and peer support, students described finding comfort in knowing that they weren't alone, that their emotions were valid, shared, and could even inspire collective action. Our evaluative findings, both from these cafes and from our 2025 scoping review, showed consistent outcomes. It showed reduced isolation and increased connection, greater emotional relief and validation, and a strengthened sense of agency and empowerment to act. The majority of the students were young women, and while we weren't able to engage many men in the past year, it is something that we're actively working on. We actually have a Climate Cafe series that is called the Gentleman's Cafe to encourage more male students to come to broaden the conversation towards them. So beyond simply providing emotional space, climate cafes are becoming a foundation for resilience and community building among students at York.
So, as Sarah mentioned, our lab did evaluate these climate cafes, and through our evaluation, the data revealed 2 distinct behavioral subgroups through latent class analysis. So, class 1 showed lower engagement, more sadness and anger, and more likely to attend our online climate cafe sessions. Class 2 showed higher engagement and intention to act, more positive emotions generally, and more likely to attend our in-person climate cafe sessions. Class 2 participants, those with higher engagement, reported engaging overall in more pro-environmental behaviors than Class 1, and we also saw a clear emotional difference. Class 1, the lower engagement, most frequently reported anger as their dominant emotion and positivity as their least experienced, whereas Class 2 had a more balanced profile. One of our most encouraging findings was an increase in participant reported comfort and frequency in talking about climate change after these climate cafe sessions. In-person sessions in particular seem to foster a more deeper engagement and more positive emotional experiences overall. So these findings point to the power of emotionally attuned, community-based interventions that highlight the importance of investing in relational, supportive climate mental health resources as a complement to policy and activism efforts.
So beyond just the quantitative evaluations, these reflections here on the screen show what the Climate Cafes meant to students, not just as a project, but as a space for healing, connection, and growth. Lisa, who is a second-year global health student, talks about finding a sense of community and leaving each cafe with more hope. Manoush in psychology describes it as grounding, a place that validates both grief and hope, which is so important when it comes to climate work. And Hasti shared how rare it is to find a space where you can talk about the emotional side of climate change without judgment. While Nidra reflected on how the cafes have become a regular part of her wellness routine, helping her feel more centered and connected after each session.
So while climate cafes offer a powerful entry for emotionally attuned climate-related conversations, our lab also recognized certain limitations. Students expressed a desire for spaces that highlight marginalized group experiences, provided them with opportunities to engage in action beyond just conversation, and also to introduce a variety in structure to avoid the repetitive nature of multiple sessions of climate cafes. So this prompted Sarah and I to launch the NEST initiative, which is a student-led project born out of both of our experiences, essentially in attending and facilitating climate cafes. So the NEST hosts bi-weekly themed circles focused on climate emotions, creative expression, and collective action. Unlike the more structured format of climate cafes, NEST circles are more fluid, action-oriented, that build on the emotional reflection sparked in climate cafes and channel it into tangible action and community care. So in essence, the NEST was created to complement the work of the Wellness Impact Lab by helping students move from emotion to action, deepening their engagement with climate wellness and community.
And this is the NEST in action. Each NEST circle brings together creative expression, wellness, and climate action. Students use art, reflection, and conversation to explore their climate emotions, to support one another, and to turn those feelings into collective action. And this promotes both inner and outer well-being, as well as overall compassion towards our planet. And even though it's still early, we're just 2 months into this initiative, we've already seen strong participation and authentic connection among the students. So far, our preliminary data from the NEST show really promising outcomes. We collected pre- and post-survey data from 26 students who participated in our first 4 events, and on average, their confidence in coping with climate challenges increased by 0.46 points on a 5-point scale by the end of the NEST circle, and there was also a measurable rise in perceived community support. Emotionally, we also observed a shift. Instead of feeling overwhelmed, more students reported feeling hopeful, calm, and motivated after each NEST circle. And in terms of engagement, 88% said they would attend again, and 96% said they would recommend the NEST circles to others, which indicates strong resonance with the format that we currently have. So taken together, these outcomes suggest that this peer-based climate well-being initiative like the NEST can strengthen emotional resilience and community support within student populations. And with these encouraging results in hand, we're now expanding our reach through our community partners.
So we'd just like to take a moment to thank our community partners. The NEST is built on a foundation of collaboration and community care, and our work would not be possible without the support and partnership of organizations who are deeply committed to climate action, mental health, and student leadership. So these partnerships reflect the intersectional nature of our work, bridging research, community, art expression, and advocacy. So together, we're building spaces to support both emotional processing and collective climate resilience.
So before we wrap up, we just love to stay connected with you guys to continue this conversation. If you'd like to learn more about our research or upcoming Climate Cafe or how to get involved with the NEST, you can reach us through the emails on the screen. And a special thank you to Dr. Harvey Skinner and Susan Harris for their guidance and leadership. And finally, thank you all so much for listening and engaging with our work, and most importantly, for caring about student well-being and climate action. Thank you.
Thank you so much, Sarah and Sophie. And then Siqi will be coming up now to give us a talk about lived experience engagement.
Good morning, everyone. Just now you heard about 2 exciting youth-led interventions. And for my presentation today, I will be shifting the population focus a little bit to a clinical population that's very close to my heart as a women's mental health psychiatrist at CAMH. And specifically, I will be speaking about the lived experience with climate change among women with mental illness and our work to better understand their service needs and to share with you some of our progress in creating potential solutions together. So what do we already know about the connection between climate change and a clinical psychiatric population? Well, pre-existing mental illness emerges as one of the biggest prognostic factors of death during heat waves. And in fact, it more than triples the risk of death, more than the risk that's conferred if someone were to have an underlying heart or lung condition. We also know that there's accumulating evidence to suggest that increased land temperatures are associated with 4 different psychiatric outcomes, and this includes increased suicide and mental disorder-related mortality, increases in suicidal behaviors, increases in hospital access because of the suicidal behaviors, and increases in hospital access because of the mental disorders alone. However, what we do not know is the actual personal narratives of the people with mental illness themselves, such as the day-to-day challenges that they may encounter that climate change has brought on, that eventually lead to these increased deaths and increased hospital use. And perhaps more importantly, what kinds of interventions would the people want to see from their perspectives? The absence of knowledge in this space, to me, reflects a form of structural inequity, whereby people with mental illness and their needs have been systematically deprioritized, and we want to be able to fill that space. So a group of us have carried out a qualitative study at CAMH, and for this study, we focused on 2 intersecting aspects of vulnerability. First is that the participants were accessing inpatient service at CAMH because that had conferred to a more severe and more acute level of psychiatric morbidity. And 2 is that the participant identifies being a woman because existing literature consistently identify women as a vulnerable group in the context of climate change because of the caregiving burdens and the gender-based violence that they face. We developed the interview questions iteratively with a co-investigator with lived experience and with a CAMH lived experience research committee. These 23 participants were between ages 18 and 70, and about half identified as coming from a racialized background. They were divided into 4 focus groups, and an overwhelming percentage of them reported significant anxiety related to climate change. I want to take the opportunity to share with you 3 selected themes that emerge from these focus group discussions. And because the quotes are very illustrative themselves, and because I want to bring the authentic voices of the participants into this space with us, I will be reading some of the quotes with you. The first theme is about the extent of isolation that the participants experience from their usual support and usual networks that leads to increased acute care that they access. One participant said, "I personally seem to lose contact or not respond and not make new appointments. I find myself isolating more and more and more, and just falling off any therapy I had going. I too have canceled doctor's appointments because of the weather that I was anticipating. All of a sudden, I can't go outside." Another participant said, "Sometimes in summers, the only social stuff I really get is if I'm in hospital. It's the only time when I'm actually around people, and that's why I don't mind being in hospital longer during really cold, really hot seasons, because I'll be in weather-controlled conditions, and I won't overheat so much, and I won't be isolated, and it just helps to stabilize me more than if I was just locked up in my apartment." The second theme I wanted to share is about the participants' challenges with their prescribed psychiatric medications, as well as their challenges navigating their relationships with their clinicians and prescribers themselves when it comes to climate change and distress-based dialogues. One participant commented about the psychiatric medications that she has to take and the side effects that make her more sensitive to extreme heat. She said, "I was never warned. I learned that as the years have gone by, you start Googling, trying to see why I'm overheating, and then you find out all these things." Another participant said, "Talking to anybody, even healthcare professionals, about climate change is tricky. Just because they're your doctor does not mean they believe in climate change, and so it becomes a barrier to communicate to your doctor about it, because you don't know whether or not they're going to be receptive to it." The third theme is really about the gendered experiences and socialized expectations that women specifically face. One participant used this analogy. She said, "For myself, out of the sexual trauma I experienced, it feels like you're seeing that happen on such a grand scale to Mother Nature, and it kind of triggers hard emotions like anxiety. Man-made changes to our climate takes away that feeling of consent." There is an overwhelming sense of guilt among the women participants about child rearing, as well as reproductive decisions. That's really resonated across multiple participants. One particular participant has said, "From a woman's perspective, you have a feeling that you need to have a motherly role, to stand up, take care of those children, and you know when you see climate change happening, it feels like you're failing and it's exhausting. It literally just spirals the depression." The women participants talked about the service gaps that they see in our current health system and proposed different kinds of interventions they would like to see. I've divided their suggestions into 4 categories. So first, from a clinician education perspective, they want their prescribers to check in with them and be more prepared to counsel side effects as it pertains to extreme heat. They also want their clinicians to more proactively check in with them, to let them know that there is the availability of a safe space should they want to discuss climate distress with them. From a patient education perspective, they want a more evidenced information about climate change and its implications on mental health. And that would help them to counter misinformation that may be very prevalent in other sources of online media. And one suggestion that they had is about co-creating a seminar about climate resilience and disaster preparedness, such that they can learn tangible skills to better protect themselves in terms of their physical health and in terms of their mental health. From a health service perspective, they mention about needing more outreach and intensified support during extreme weathers. And multiple participants actually spontaneously mentioned the unexpected therapeutic effect of participating in focus groups themselves, and they emphasized the need for even non-clinical spaces for connection. And finally, the participants really emphasized that there needs to be a broader recognition from a system level about the connection between climate change and mental health, such that if any changes and initiatives were to happen in the future, it is more than individual changes from the patients and from the clinicians. These rich insights from the participants informed actions that we have carried out and we plan to carry out in the future. First, we conducted 5 consecutive focus groups afterwards with 25 frontline mental health clinicians to share with them the patient narratives and to contextualize the patient findings. We've also developed an easy-to-read prescription guide on psychotropic medications in the context of extreme heat that was published in a medical journal this year, and you're very welcome to share this resource with your networks. Our hospital has developed a heat wave guide, and this past summer we were able to implement the guide into the inpatient units such that there can be a package of patient-facing materials on heat, safety, and tips to keep well, that's available for patients at the time of their discharge. We're also in active discussion with lived experience experts, our colleagues at the University Health Network, to co-develop the heat resilience intervention for patients. We also planned a hackathon day, and traditionally speaking, hackathons are when coders and computer programmers come together to hack or come up with a solution to a complex challenge. And we're using similar methodology to bring together lived experience experts, engineers, clinicians, and researchers to co-design interventions informed by these focus group discussions and to come up with ways to better evaluate their effectiveness. And we're just currently waiting for funding decision. And finally, some of us have been fortunate to be part of the very newly launched Lancet Psychiatry Commission on Climate Change and Mental Health. And we're actively recruiting lived experience experts to form an advisory group such that their perspectives will be integrated throughout this commission as well as the eventual commission report for policymakers. My takeaway messages are threefold. One is to listen and engage. It's absolutely critical to involve people with lived experience in planning any climate resilient health services, especially as understanding lived experience really uncovers these hidden mechanisms of vulnerability. Two is about addressing the gender burdens within climate and health adaptation strategies. And finally, let's foster connection and hope that's echoed throughout today's presentations so that we can create more spaces, whether it's climate cafes or peer groups or lived experience committees, so that we can transform anxiety into shared action. I would like to acknowledge all the participants of the study as well as the organizations and people who made this study possible. And thank you, and please do get in touch if you want to collaborate with us and if you have any questions or feedback.
Thank you so much, all of the presenters today. What amazing talks and just such important work in amplifying the voices of youth and mobilizing action and really engaging with people with lived experiences. So we do have time now for discussion, and that's the beauty of these panels, is that we engage in conversation now. And so I would love to see some people come up. There's a microphone up here, and invite you to come up and ask questions of our panelists. So please do come up and ask questions. Maybe you're thinking through the questions that you have in your mind. So maybe while you're thinking about the questions you'd like to ask, I'll start with a question of my own. And I'm thinking about, diversity, and of course, you've touched on it, each of you, how you're, deliberately and intentionally seeking engagement with diverse voices. But I wondered if you might want to, each of you, elaborate on that. How are you ensuring that your engagement is truly reflecting the voices of people from diverse backgrounds? Swelen, can I start with you?
Yeah, sure.
Great.
So for us, from the very beginning, everyone who has been engaging in this project represents diverse backgrounds, but also our recruitment materials really speak to centering, wanting to work with young people who are Indigenous, Black, racialized, but also young people with disabilities. And most importantly, not only is it the intentional outreach, engagement, and recruitment, but also the kinds of practices that we've put in place that allow for access and reducing barriers. So for example, we've really centered all of our work in our relationships and building trust and being flexible and really meeting young people where they're at, and then hearing what kind of ways they want to be involved and then adjusting and iterating. And and also communicating very clearly. I think what we see is that it's a ripple effect, because as we bring in really diverse voices, we see that the content that we come up with together actually reflects the realities and it celebrates the voices, the stories of indigenous water protectors and land defenders, and of Black communities working for climate justice where they live. And we see that in itself draws in more young people that see themselves reflected in the program. And so it's really beautiful to see a continuous cycle. And yeah, these are just some ideas on how we try to approach our work.
Wonderful. Should we pass it along to Sophia and Sarah?
So one of the really amazing things about working with the student community is that, especially at York, we have a lot of international and transnational students. And this allows us to have a lot of different voices that can give input and can help us create spaces that are more comfortable and more intentional for people with different backgrounds. One of our goals when we created the Nest was to have intentional spaces for people who have different experiences and different backgrounds when facing the climate crisis. And so Sarah and I are always really open, and we're always telling all of the students who come to Nest Circles that if there's a way that we can make this feel more accessible to you, please let us know. We really love hearing student voices, and if Sarah has anything to add to that, I'll let her say something.
I can add that I think the first step is to listen to students, because from our climate cafes, we noticed a lot of transnational students, like Sophia said, and because of that, our lab did spin-off climate cafes, which we're calling world cafes, where it's more focused on belonging and what countries you're connected to. Like for me specifically, I was born and raised in Toronto, but I am from Sudan, and my connection to climate change and my emotions to climate change is really connected to Sudan and the extreme heat and weather that's going on over there. And a lot of students at York also feel that way, since it's a very diverse university. So I think just listening to the students and then accommodating to them as well. I know we mentioned that we have gentlemen cafes now for male-identified students to talk about climate emotion. So I really believe that just listening to the students and then engaging them from what they said.
Siqi?
From a diversity perspective, our study was a women-focused study. However, we really try to bring different perspectives through several other aspects. One of them is age. So that translates to women of different ages coming together in intergenerational dialogues, because there may be perspectives brought on by women who are considering becoming mothers. There are mothers raising young children, and as well as mothers who have grown-up children but now face the responsibilities of caring for an aging generation, and that brings on different layers of complexities. The other aspect of diversity we try to bring in is diversity in psychiatric diagnoses, and as well as the different kinds of medications that people may be exposed to. So for example, if someone were to have an underlying depression, or someone has an underlying schizophrenia, the challenges that they face may be very different. For example, one participant talked about the challenges she faced when she has to go to the pharmacy every single day to pick up medications. And this is not an uncommon practice in some related to some psychiatric disorders, and the challenges that this really brings to her life when there are extreme weather events. So it really is about paying attention to how climate change and extreme weather events affect people who are already disproportionately affected and vulnerable, and that includes people who have to access food banks on a daily basis, who don't have access to cars and have to rely walking outdoors, and people who do have to pick up their medications every day from a pharmacy, and the diversity of dialogues across different psychiatric diagnoses and socioeconomic classes.
Yeah, I can start. Thank you so much for your question, Fiona. It's a really good question. I do think it's a tension that we grapple with often as we are, especially as we uncover the elements of this program and with young people. What we're finding is that what really supports us in holding that tension is actually really learning from First Nations, Inuit and Métis perspectives on what does it mean to exist in a web of interconnections, and how our actions and as individuals are tied to larger systemic change. And it's not so much in seeing individuals as, like I said, we're trying to promote engagement in action. I think it's been very important to transmit messages, and like this is something that we have heard from our youth advisors as well, and that they're supporting transmitting messages that are rooted in allowing young people to see even their sense of individuality being challenged. Like we are, even our sense of self can in itself be seen as wider than the edges of our body. And like our sense of self is connected. We are part of a larger world. And if we begin to see ourselves as such, and if we can foster this like ecological self, then perhaps the actions that we do take within our own locus of control do not need to be really be falling entirely on our own shoulders, but we actually begin to see and foster a critical understanding that we're part of a system. And so I think like mobilizing more awareness and like knowledge about how systems, how like climate change is rooted in a systemic issue, can also support our young participants to not just see this as like their individual responsibility to fix this, which is not going to actually happen, but instead understand strategically then how can I address the systems that I'm connected to. So, yeah.
Do any of the other panelists have an answer? Sophia, you ready?
I find that for students in particular, it's a little bit hard to do individual action, and I feel like from my experience in attending and hosting climate cafes and other climate wellness initiatives, there's a power and a sense of belonging that comes with collective action that really drives students to engage. A lot of students suffer from loneliness and suffer from isolation, and especially in the current age. And I personally see the power of bringing students together and them not feeling alone in their thoughts, and them being able to share their stories and to resonate with other people, and this sparking their feelings to engage with the climate even more than if they just try to do something themselves. And another thing too is that I feel like collective action really sparks individual action, because in these spaces where you can do some kind of collective action with a bunch of other students, you learn individual resources, particularly at climate cafes and at the Nest. We teach students, we give students resources so that if they would like to do something outside of these spaces, we provide them with opportunities on how to do that. And I feel like that really benefits students.
I can just add that I think students in general, especially at York, they're looking for a collective space to do some sort of action towards climate. I don't really see them having an individual mindset when it comes to climate change. I think they all know to come together and want to do something, just to add on to what Sophia said.
And I just wanted to echo my panelists' responses to say that I see this issue as more of a cognitive framing. So on one hand, someone may see that this is an individual responsibility or have a sense of burden about having to do more. On the other hand, what we see from the focus groups is that our participants actually want to be active agents in having more ownership and more control of the situation, rather than having a sense of burden or responsibility. And so it's, and we also want to ensure that our patients, our lived experience participants don't feel that they're alone in this problem. And that's why we are sharing their perspectives with the clinicians, with the wider hospital, and with larger global commissions, so that we can demonstrate that really we're all in this together and we're working together to solve a common issue that's very relevant to all of us. I think that's a very, very important question, and I fully agree with you that it's very possible that, especially for our patient populations, the patients who identify with climate distress, that likely are more likely to consent to participate. Whereas in my work, I found it not to be completely true among the clinician focus groups that I facilitated, because in one of the focus groups we ran, there was actually a big conflict among the clinicians, even though they were all healthcare professionals, about climate change, about how urgent the issue may be. And so your question is absolutely relevant, and I saw it firsthand about that conflict. I think what we learned is that even more so the importance of having a space, a neutral space for dialogues to happen, because people who believe in different things, maybe across a political spectrum, may not even have the space to meet each other and to really understand each other's perspectives. And after that highly conflictual focus group, we ended up having a facilitated dialogue, and the clinicians were actually able to learn something from each other so that they can better have a mutual understanding of potential some shared common goals of working with each other and serving the patients.
Actually, Sophia and I actually did run into a couple students that essentially didn't believe in climate change when we were tabling at York, which is where we basically set up some information about the climate cafes or the nest, and then they were engaging with us. And I remember one student I told him to attend a climate cafe, and he attended a spin-off version, which was a World Cafe. It's towards transnational students, and he was very standoffish during the facilitation, the whole event. But afterwards, he actually emailed us and said that hearing other people's perspectives of what's happening in, for example, India or Sudan with floods and extreme heat, that he started researching more about it, and he actually said that he wants to do more, and he wants to lean towards climate action. So I think engaging them, or at least trying to engage them with climate cafes or anything that has to do with like climate wellness, and so they can hear other people's perspectives, can really shift their mindset towards climate change.
We haven't really encountered this issue yet, and that said, I think for our like during our youth advisory sessions, what's been really important is actually being very open to expanding the conversation of climate change to involve the concept of planetary health. And I think that really has resonated for young people, especially because there are concerns as well as impacts of, biodiversity and pollution, and it's not just the climate. But also a lot of young people have come with concerns about transit and housing and like their lived experience day to day. And it's not a necessary direct link to climate. And it's more the knowledge about the climate crisis that it's causing their distress. But in the day-to-day, it's like the lack of access to affordable housing or to a transit system that actually functions. And like that is really what's causing a lot of their distress. What I'm really curious about is how, as we aim to actually scale this program across communities that are all going to be different, and how can we actually learn from other community partners who are engaging in this space and shift some of the ways in which we actually, we're very open to shifting our language and understanding that for some communities, climate is not something, as a word, as a term, is not necessarily resonant. But what does it mean to actually almost like deconstruct it and then allow for communities to actually connect to the issues underlying it as a way of folding them into the conversation. What's really beautiful about the Active Hope model is that it's designed not with the climate crisis as like the only crisis that we are addressing. It's actually about the poly crisis. Like there are wars, there is economic breakdown, there is like so much happening at once. So we really want to acknowledge all of these realities, not just climate change.
Well, personally, one of the NEST events, we have a few collaborators that we've been working with because we've found that students, they really connect to the idea of engaging with the community. So one of our partners has been Sierra Club Canada. I'm not sure if anyone here is familiar with them, but they have different subgroups. So there's Sierra Club Ontario, and then for the other provinces, so we specifically worked with the Ontario. And it was really great. The students really resonated with the resources that the representative from Sierra Club Ontario was able to provide. And especially since those resources were in the GTA and different free events for youth to attend in the GTA, I think that they really enjoyed that because sometimes nobody lives on campus, right? We live in our houses, and it's nice to know what's going on around us, what community events are happening, and specifically, I know Sierra Club Canada is very involved in the community, in the schools, and in universities. So we found that it was very beneficial.
For us, we're not direct, other than the David Suzuki Foundation, who is one of our partners, we're not actually intentionally collaborating with other movements. But I've been personally involved in multiple movements for climate justice, and the lens that I've been bringing to the work, and that it's being also encouraged and by our youth partners and experts, is really, there's like a thirst for understanding how power functions and what are the avenues for collective change. And so what we've done is, in the last stage of the Active Hope spiral about it's going forth, we have really integrated adaptations that are about building literacy about social power and how does it really function, while also obviously maintaining a nonpartisan perspective, but it's really about building literacy, about understanding how, like, the power of social movements. We actually feature examples of existing social movements, not only that First Nations leaders and communities are partaking in, but also like youth-led social movements. And so that is kind of that's the approach that we're taking. It's a more educational one. But really, like, we want to make sure that we are addressing in and trying to make connections between young people and collective action, while also understanding that we have a very clear scope, which is also to support a space for them to process their climate-related distress. And it's all linked, but I don't know, I think like part of them building their action plans is also giving them resources. So we also have like a list of groups that they can potentially join. But at the end of the day, the focus is on the mental health aspect.
We use social media to connect with students, but we both found that besides social media, tabling, which is where you go on campus and basically like stop students and tell them about the nest or about climate cafes, is a really big way to connect with students. Like we have a trifold poster that says, how do you feel about climate change? And that really, and then there's like sticky notes for them to like write on it. And we think that that is like a very provoking question for people to come, and then we engage with them that way. If you want to add anything, Sophia.
Yes, I agree. Tabling and just being out and around so they can see you while they're walking through the halls is a super effective way. We also have a petition station on campus too, so people can come look at different petitions that they resonate with and sign them if they're interested, which is also a pretty engaging thing. So definitely in-person, tabling, or social media work the best.